So good morning, good afternoon, good evening, and welcome to the third edition of the Global Public Health Week, an initiative of the World Federation of Public Health Association. Today, I have the great pleasure to discuss about personalized medicine with Professor Stefania Boccia. Professor Boccia is the director of the section of hygiene, University Department of Health Science and Public Health at the Catholic University of Sacred Heart in Rome. Welcome, Stefania.
Welcome, nice to see you, Marta.
So today we want to have a brief chat about a project that has been recently concluded last year that is called IC2Permed, which is about personalized medicine and way to align it between Europe and China. The World Federation has been a partner of the World Consortium that has worked toward the development of a roadmap for personalized medicine, and Professor Boccia has been one of the leaders of this project. So, Stefania, I would like to have a brief chat with you about the key activity and the key achievement of this project. Could you please provide an overview of the IC2Permed project, highlighting the main accomplishment and also the challenges that you encountered during the project?
Thank you, Marta. Yes, it's my pleasure to report briefly on the IC2Permed project that we have been running for 4 years together. It was funded under the Horizon 2020, so the framework program of the European Commission that ended the last year. And the project aimed at enhancing the collaboration between the European Union and China in the field of personalized medicine. The project comprised 10 partners, of which 7 were from Europe and 3 from China, in order to facilitate collaboration across 4 main areas: mapping personalized medicine policies and programs and research, exchange on expertising, exemplification, and also stakeholder engagement. We achieved significant results, including the identification of relevant policies and programs in personalized medicine in both regions that were testified by a number of also scientific publications available online for free on PubMed. Then the establishment of collaboration networks and the development of concrete practices for successful collaboration, as reported in the IC2Permed roadmap that is available on the website of the project, which is in fact the main project outcome that collected all the project results and the achievements. I have to say also that the project successfully integrated Chinese stakeholders along all the 4 years of activities, promoting international collaboration through a specific memorandum of understanding that was signed across all the partners and also other institutions that joined along the course of the project development. So in a nutshell, this was an overview of the project.
Thank you very much. And can you develop a bit more on how the project has contributed to fostering the adoption and implementation of personalized medicine in Europe and in China?
Yes, so the project facilitated the advancement of the collaboration on personalized medicine between Europe and China through adherence to its core project pillars that include comprehensive mapping exercises that, as I said, identify key policies, programs, action, and also all the activities, including biobanking, related to personalized medicine in both regions. The results of all the exercises underwent a rigorous discussion and also validation through 3 different working groups and also a Delphi survey that led to the development of the IC2Permed roadmap. And all these policies mapped and also expertising and Delphi interviews are reported in detail in website and started from an initial identification and engagement of stakeholders in Europe and also in China that was very much facilitated also from a great collaboration of our Chinese partners that were very good enough in also having funding from the MOST that was not given for granted at the beginning of the life of the project. So I have to say that this also is a testify of to what extent also the Ministry of Science and University in China really paid attention, okay, to our project funded only in Europe at the beginning, okay, but it was also funded, as I said, from the MOST China. So this is a strong testimony of the importance of this project. So the roadmap, as I said before, collected all this experience, okay, and delineates the personalized medicine priorities in Europe and China, very much similar, I have to say, but also we emphasize the difference and the potential obstacles, including cultural issues. Stakeholder engagement, again, has been an important priority to develop a continuing collaboration and dialogue, and also fostering collaboration between Europe and China, culminating, as I said, in establishment of a memorandum of understanding among partners, but also other entities like School of Artificial Intelligence at Beijing University of Post and Telecommunication, and also the Fuwai Hospital that was not included at the beginning in the partnership of the project. And the memorandum, however, I have to say that remain open to further participation, with the overarching goal of sustaining and enriching collaboration research initiative in personalized medicine between all the parties.
Thank you very much, Stefania. Do you think that this project could be expanded beyond Europe and China? And if so, how?
Yes, okay, so the project results have been presented also to a broader audience, okay, during various events in 4 years, including a webinar organized by the World Federation of Public Health Association on why we need personalized medicine in cancer, okay, that was organized, in fact, from you, Marta. That was an international symposium held in Geneva, featuring the participation of very high-level stakeholders in personalized medicine from Europe and China. During the, if I'm not wrong, it was the 17 World Congress of Public Health. Also, the project results were presented to over 3,000 participants, okay, policymakers. So in general, we already worked, okay, in the past years in order to expand the collaboration beyond the borders of the partners. And also the promotion of the roadmap and the establishment of the memorandum of understanding remain vital in order to maintain the project goal and to try to continue fostering the collaboration between Europe and China beyond the borders of the project partners. And also the 9 publications, scientific academic publications that were published and available on our website, I think that will help in continuing dissemination of the project activities aimed to broader the audience. And also we have a LinkedIn and X page that remained active until December, and also we made a number of posts during January. So I have to say that in this sense we can trust that there is a continuing effort to maintain this output vital.
Thank you very much, Stefania. One last question from my side. You are part not only of the IC2Permed, but of many other projects dealing with personalized medicine in Europe. Could you give us a taste of what is ongoing in our region about personalized medicine, and also your vision of what personalized medicine can impact the health system in Europe?
Okay, thank you for this question, Marta. So now there is a very important initiative which is called the European Partnership on Personalized Medicine that we had also the chance to discuss internally in IC2Permed the last summer. Just before the end of the program, we had a meeting in Nice, in Geneva, Nice in France, because there is an important partner of this project that is in charge of dissemination, okay? And during the meeting they organized, the company's GAC in France, in Nice, we discussed about the collaboration with the Partnership on Personalized Medicine that just started on October. So a few months ago, we had the chance to discuss on the continuing potential collaboration with Chinese partners in the context of the European Partnership on Personalized Medicine that published a strategic research and innovation agenda on September, and in October they launched also this partnership. In this partnership, there is a specific work package dedicated to international collaboration, and so I think that in this context there is a space to understand how we can continue the collaboration as Europeans together with the Chinese partners. And we have a good dialogue, okay, with the European Partnership in Personalized Medicine. In fact, also when we we had a delegation visit in October in China, and there was also a delegate from the partnership, Monica Frenzel, that is in charge of the funding in France of research. And she testified with her presence in delegation visit in China that the collaboration with the Chinese stakeholders involved in personalized medicine will continue along the line of the European partnership in personalized medicine. So I think we should take a very close look, okay, at this initiative, both as academic, as World Federation, in order to try to find a way to continue in this endeavor without giving space of ending all this effort for 4 years.
Thank you very much, Stefania. And maybe a few more words from your side on the second part of my question. How do you see personalized medicine in European health system? How can we implement, and would it change the way we prevent and treat the disease?
Okay, yes. Sorry, I missed this question. I have to say, personalized medicine formed the way a number of patients there were a lot of issues about reimbursement model, about the evidence of health economics, but these were accumulated in the past few years. The same for diagnosis. Now the diagnosis of rare disease do pass through a genome sequencing, okay? This is not true in a number of countries. This is certainly true, but in Europe, this is a reality, okay? So in the past years, we assisted already to a revolution.
So could you please elaborate a bit more on the last part of my question? So how do you see personalized medicine in the future? Do you think it will have a big impact of our health system in preventing and treating disease? And if so, how?
Thank you, Marta, for this question. This is a crucial issue because currently personalized medicine is incorporated in most of the European countries in the field of treatment. Cancer treatment, cardiovascular disease already benefit from the use of genetic and genomic testing and also diagnosis of rare diseases. But this is not the same for all European countries, okay? For a number of European countries, especially for those from the East, this is still a dream for a number of genetic and genomic testing in the field of treatment or diagnosis. When it comes to prevention, instead, we are more back, okay? So we still need a lot of evidences on the clinical utility. Evidences also on the economic aspect, on the reimbursement, and also on the organizational aspects, because a number of tests maybe can be available. There is maybe evidence that improve health outcome, but doctors maybe do not understand exactly how to interpret the results, how to manage also the citizen communication, because it's not, when it comes to prevention, it's not only about patient, it's also about citizen. And it's sometimes very hard when there is no basic health literacy in science to explain them what's the meaning of a probability related to a genetic test, which is not a certainty. So I have to say that the research needs to be done, but also research on the organizational aspects is very important to be done. And this is something that usually is done in the context of public health research.
Thank you very much, Professor Boccia. Very, very useful. So thank you very much for your time, for sharing your knowledge. And I invite all people following us during the Global Public Health Week to think about personalized medicine and to have a look at the results of the IC2Permed project on the dedicated website. Thank you very much.
And success for the Public Health Week.
Thank you.